A patient sees an average of 18 healthcare professionals during their hospitalization. 18 healthcare professionals with unplanned visits, drop-ins from early morning wake-ups to late-night checks. How disorienting to be a patient, but not only a patient, a healthcare provider trying to provide care to that patient. In healthcare, we pride ourselves on continuing education. Medicine's always changing. Staying up to date on the best practices is how we provide the best care we can for our patients. Each healthcare professional is an expert in their own field, explicitly specialized to care for those patients. From a cardiologist to a cardiothoracic surgeon, an occupational therapist to a pharmacist. We're all experts separately. Now, what if we brought all these experts together at the bed space of each patient to discuss a plan as a whole with the patient and their family? To ask questions, address concerns, speak of progress and progression. Patients may be happier. It could possibly lead to better patient outcomes. But what if these experiences were also educational for everyone involved? We're all healthcare providers, but we also share another thing in common. We're also educators. David Kolb once said there are two goals in the experiential learning process. One is to learn the specifics of a particular subject, and the other is to learn about one's own learning process. As specialists, we've already learned our particular subjects. However, in this group setting, this team of specialists coming together, we reflect on the patient. With reflective observation on those concrete experiences, that is what leads to abstract conceptualization. It is the bread and butter of Kolb's experiential learning theory. Promoting progress through reflection is the single most important thing I believe we can do as healthcare professionals, educators. As a respiratory therapist, I teach my patients every day. I teach them how to use tools to breathe easier. However, one day, I had the opportunity to be a part of something amazing. I had the honor to be a part of a multidisciplinary team consisting of a cardiothoracic surgeon, cardiologist, intensivist, pulmonologist, pharmacist, physical therapist, nurse, and nurse practitioner. Every morning at 8 a.m., we rounded on patients, bed space by bed space, the sickest patients in the hospital. These patients were on ECMO. During rounds, each one of us spoke of this patient as equals, all egos aside. Each one of our thoughts, questions, opinions were heard and discussed with the group. Each one of us specialists learning from each other to better care for the patients without ego, pride, or being the hero. This is how we transform health professions educations together.